This has been a great discussion. We've reviewed and discussed a lot of information in the latest treatment of lung cancer. To close, I'd like to get some final thoughts from each of the panelists. I'll start with Mary Jo.
I thought this year at ASCO, lung cancer was a shining light in ASCO. You compare with some other tumor types, I feel like we had so much exciting data, both with the immunotherapy, and I feel like in the lung cancer world, we're a little further along, excluding melanoma, of course, but also with some of the second, third generation targeted agents. I think it's an exciting time, and I have always been an optimistic person, but I feel like there's reasons for patients to be more hopeful now.
Really optimistic, particularly if you were going to ASCO in the early 90s in lung cancer. So Roy?
Which I was.
Yeah. That's right.
And in those days we had chemotherapy, metso. We had radiation therapy and surgery. And over the course of the last 20 years, we've added targeted therapy, realizing the limits of targeted therapy with resistance, and only a few small percentage of patients benefit. And now we have immunotherapy. So we've added 2 new modalities, and now the challenge for all of us is how to integrate that all together, in the curable and the palliative settings, and I think we're seeing that that's happening.
Yeah. Jeff,
Every one of my patients, I talk about modalities, right? Chemo, targeted, and immune therapy, and that's such a neat evolution. I'm not sure that's in every doctor's office, and that needs to be part of every doctor, right? Every oncologist needs to have a piece of that optimism because patients trickle into me not having heard this stuff, so we need to make sure everyone knows about that and gets a piece of what's happening.
And Naiyer, final thoughts?
I think you need a Sunday morning talk show because you're so good at this. I think PD-L1 or PD-1. I think that this is kind of the new cisplatin. It's like the new backbone that we're going to build, combinations and strategies on for the rest of our careers. And I think we're going to be pushing that plateau up.
Great. Well, on behalf of our panel, we thank you for joining us, and we hope you found this peer exchange informative. Thank you.